blood glucose regulations. The main function of glucose is as a source of energy for almost all cells in the body. Blood sugar regulation is the process of balancing insulin and glucagon to maintain blood glucose. Blood sugar levels are regulated by negative feedback in order to keep the body in balance. The levels of glucose in the blood are monitored by many tissues, but the cell in the pancreatic islets are among the most well understood and important. If blood glucose level rise, the beta cell of the pancreas respond by secreting insulin. Insulin stimulates most body cells to increase their rate of glucose uptake from the blood. It increases the cellular rate of glucose utilization as an energy source. Insulin accelerates the formation of glycogen from glucose in liver and skeletal muscle cells. It stimulates fat synthesis from glucose in liver cell and adipose tissue. These effects collectively cause a decrease in blood glucose levels back to normal levels. Hormones involved when blood levels increase are insulin and somatostatin.
If blood glucose level fall below normal level, insulin secretion is inhibited, and at the same time the alpha cell of the pancreas respond by secreting glucagon. Glucagon accelerates the breakdown of glycogen to glucose in liver and skeletal muscle cells. It increases the breakdown of fat to fatty acid and glycerol in adipose tissue, and consequently the release of this substance into the blood, which cell can use for energy. It stimulates liver cells to increase glucose synthesis from glycerol absorbed from the blood and glucose released into the blood. These effects collectively cause an increase in blood glucose levels back to normal levels. Hormones involved when blood level decrease are glucagon, epinephrine, cortisol, adrenocorticotropic hormone, growth hormone, and thyroxine.
Disease and blood sugar regulation. Below normal range. In Addison disease, your adrenal glands located just above your kidneys produce too little cortisol and often too little aldosterone. There are two types of Addison disease. Type 1 is primary adrenal insufficiency and type 2 is secondary adrenal insufficiency. Here are the symptoms of Addison disease.
Above normal range, there are F4 readings according to the target level of types. Diabetes is a condition in which blood sugar levels are higher than normal. It occurs where the pancreas no longer produces insulin or is unable to use its own insulin effectively. Insulin carries sugar in the bloodstream and is used to supply energy. High glucose level will damage organs and tissues in the body. Diabetes mellitus. There are F2 types. Type 1 is insulin dependent, usually occurs in children and adolescents. And type 2, non-insulin dependence. More than 90% of people are found to be especially elderly and overweight.